Herpes simplex virus, commonly known as HSV, is a fascinating yet often misunderstood virus. It's important to understand that HSV is categorized into two types, HSV1 and HSV2. HSV1 primarily causes oral herpes, which is characterized by cold sores or fever blisters around the mouth. On the other hand, HSV2 is typically responsible for genital herpes, which manifests as sores in the genital and anal areas. Interestingly, either type can affect either location. For example, HSV1 can cause genital herpes through oral genital contact. Transmission of the herpes virus occurs through direct contact with an infected area or bodily fluid, even when symptoms are not visible. This means that individuals can spread the virus even if they don't have active sores or symptoms, a phenomenon known as asymptomatic shedding. This is crucial information, as it emphasizes the importance of practicing safe methods to reduce the risk of transmission. Once the herpes virus enters the body, it travels along sensory nerves to become dormant in the nerve roots. This dormancy can last for extended periods. However, the virus can be reactivated due to various triggers, which may include stress, illness, sunlight, or hormonal changes. When reactivated, the virus travels back to the skin's surface, where it can cause symptomatic outbreaks. The frequency and severity of these outbreaks vary from person to person. Symptoms of herpes infections can be quite uncomfortable. In the case of oral herpes, individuals may experience tingling, itching, or burning sensations around the lips, followed by the appearance of painful blisters. These blisters eventually break and crust over. For genital herpes, the symptoms can include similar blister formations, accompanied by pain during urination or sexual intercourse, along with flu-like symptoms during the initial outbreak. It's important to note that while there is currently no cure for herpes, several effective management strategies are available. Antiviral medications such as acyclovir, valacyclovir, and famciclovir can help reduce the severity and frequency of outbreaks, as well as lower the risk of transmission to partners. These medications work best when taken at the first sign of an outbreak, but they can also be used daily as suppressive therapy to minimize the frequency of outbreaks and reduce the risk of asymptomatic transmission. Individuals diagnosed with HSV often face emotional and psychological challenges due to the stigma associated with the virus. Understanding that herpes is a common infection that affects a significant portion of the population can help in reducing feelings of isolation. Open communication with partners about HSV status and safe sex practices is vital in managing relationships and preventing the spread of the virus. Testing for herpes typically involves a physical examination and, if necessary, laboratory tests. These tests can include viral cultures from active sores or blood tests to detect antibodies against the virus. If you suspect you have herpes or have been exposed, it's essential to consult with a healthcare provider for appropriate testing and guidance. Preventive measures play a critical role in reducing the spread of the virus. Using barrier methods like condoms can significantly lower the risk, although they do not eliminate it completely. Additionally, avoiding sexual contact during an outbreak and discussing STI status with partners can empower individuals to take control of their sexual health. As we continue to learn more about HSV, research is ongoing to improve treatment options and possibly develop a vaccine. In the meantime, raising awareness and education on herpes transmission, prevention, and management is crucial. It's essential to break the stigma surrounding HSV and encourage discussions about sexual health, emphasizing that people living with the virus can lead healthy, fulfilling lives while minimizing the risk of transmission. In summary, although herpes simplex virus poses health and emotional challenges, understanding its nature and adopting informed preventive measures can make a significant difference. By fostering open dialogue and supporting each other, we can create a more informed and compassionate society regarding HSV and other sexually transmitted infections. Thank you for joining me today in understanding more about herpes simplex virus.